menace, we all understand. But we find ourselves in a precarious situation as a country prone to this disease for several reasons. The burden of diabetes is high and increasing globally, and in India, we not just have overweight, obesity, and unhealthy lifestyles to blame, but also family histories. The estimates show that diabetes in India is expected to rise to over 134 million by 2045, and this is when approximately 50% of these individuals remain undiagnosed. What do we need to work on? We need to work on awareness, prevention, and timely intervention. Joining me to discuss this and more, my special guest, lovely ladies, Dr. Dakshita Patil, preventive diabetologist and director at Conquer Diabetes Center, Mumbai. Dr. Sonali Patange, consultant diabetologist, founder and director of Dr. Sonali Patange's Specialty Diabetes Center, and someone with a keen eye on research and development in this field. And Dr. Shubhashree Patil, consultant diabetologist and director, Diabetes and Wellness Clinic, Mumbai. Welcome, doctors, to the show.
Thank you.
Dr. Dakshita, if I may start with you, the theme for World Diabetes Day is Educate to Protect Tomorrow. And we are talking about awareness. Do you still feel that people in India need to be made aware of diabetes? And on the same page, if you can brief us about the role of patient education throughout the treatment term. And I also know you run a club, which is called the Om Diabetes Club. So, too many questions, but
India is second world capital of diabetes. We need to know that. And education is the most powerful weapon to change the world. Now, in diabetes, we have diet, we have exercise, we have medicines, we have monitoring, but the fifth important pillar is education, because it's a lifelong process. It's a life.
आपको देखने के लिए मिल रहा है, एक शाइन आपको देखने के लिए मिल रही है, चमक आपको देखने के लिए मिल रही है. अच्छा, हैरान मत होइए कि आप
few points which are very, very important, and they will give them confidence to manage their diabetes. So Om Diabetes Club is truly a patient support group of diabetic patients, more than 25,000 diabetic patients, and we have annual functions where there is a patient education lecture. More than 1,000 patients attend at a time, so we make them aware about complications, and mainly we give them insight into positive thinking, how positive thinking helps to live well with diabetes.
Dr. Sonali, I would want to know from you, can technology be used in awareness and both for people with diabetes and the ones who needs to be aware of?
I think that's a very pertinent question at this point of time, because there's so much of technology around us. So it has also penetrated diabetes. So we have sensors, we have pumps. So sensors are some devices which we can wear either on your hand or your tummy, and there is a reader with it, so you can actually read the readings at the same time. So every hourly you can keep a track of your blood glucose. So works very well with children with type 1 diabetes, as Dr. Dakshita was mentioning. They are very difficult to manage at times with their school timings and education classes going on. Also in pregnant patients we use them quite a lot. People who are on multiple shots of insulin also do very well with this device. Secondly, insulin pumps. That is a very good technology which we are using in our clinics quite often with young diabetics, with children with type 1 diabetes. It helps in controlling their blood glucose, avoids the spikes, as well as keeps it under level and avoids the hypos. So like the sensor and the pump can work in conjunction, and so it can set off an alarm when the sugar is dropping. So then the patient actually knows that his blood glucose is about to drop or has dropped, and then can get up and actually correct and check.
Dr. Patil, we are a country where either we are fasting or we are feasting, and either or is diabetes friendly. So what are your thoughts on how to manage your life while you're fasting and you're feasting, and in between when you are not doing either and trying to balance the diet?
That is true. Actually, India as a country, I think we have a very rich cultural and religious heritage.
Because of this, we see variety of fasting and feasting ways. As diabetics who are on medications, during the fasting days, we are very concerned because they may develop a condition called as low blood sugar levels, that is hypoglycemia. And during the feasting days, there could be high rise in the blood sugar levels, that is hypoglycemia. Both these fluctuations in the blood sugar levels may eventually lead to metabolic complications of diabetes. Therefore, special population like elderly, children, people who are type 1 diabetics on insulin, and people who have coexisting medical illnesses like heart diseases, kidney diseases, we ask them to refrain from fasting. We ask them to eat more regular meals and maintain their blood sugars in a stable manner rather than getting exposed to the fluctuations. Whereas when we talk about well-controlled diabetics definitely can have a period of fasting and feasting, but of course under medical supervision. So a pre-assessment needs to be done, a medical assessment needs to be done. A proper nutritional counseling needs to be planned for these patients, wherein like in Navratri, we ask them not to indulge in oily deep fried meals. We ask them to indulge and make more healthy choices. When it comes to Ramadan, we ask them to have more complex carbohydrates in the morning along with proteins. And when they break the fast, at that time, simple carbohydrates is something that we recommend them. We also need to educate them regarding sugar monitoring, which is a very important aspect. So they need to keep a track on where their blood sugars are going.
Right.
And every doctor needs to make a customized treatment plan for his or her patient as per the requirement of them. So that's how any well-controlled diabetic definitely can have periods of fasting and feasting without having any long-term medical repercussions on the health.
When you are meeting patients, and one of the things that patients fear is amputation. That also is, at the other end of the spectrum. And there would be several signs before you actually get to that stage. But what are the most common fears people come with? And when it is about seeing the signs on your body, what do you tell your patients how to be looking at those signs and be cognizant of that?
Right. So diabetes, I don't want to use this word killer, but it is a silent killer. You don't have any symptoms, you don't have any symptoms for chronic complications till you have any medical emergency. And as you rightly said about amputation, so I just want to give an insight that every 20 seconds a limb is getting amputated in India, every 20 seconds. So this is the huge burden of diabetic foot complications because of probably reduced blood supply or reduced sensations in feet because of high blood sugar. I won't say it is because of diabetes. Nothing happens because of diabetes. Everything happens because of high blood sugar in diabetes. So everyone needs to know on this show and the audience that nothing is because of diabetes. Don't get scared of diabetes. If your sugars are not controlled, then you will develop these complications, and we need to really reinforce this to each and every patient. Now, simple few minutes spent with patients, giving foot care tips, that will take them long way. Don't walk barefoot. That is the first thing. Most of the injuries are domestic injuries. You get hurt in your own house because you don't walk barefoot on the road. So start wearing footwear in the house. Start wearing a proper footwear. Inspect your feet regularly. We see our face in the mirror so many times. So inspect your feet regularly and watch for warning signs and symptoms, some discharge, redness, corn, callus. And you have to be really watchful and report to your diabetologist immediately. This is very important. Indian Podiatry Association is working on a massive platform to achieve zero amputation rate, and we need good luck from you for that.
Technology plays an important role. Awareness plays an important role. Social media sort of plays an important role, and I wonder how social media contributes to this whole narrative where we are talking about both the positive and the negatives of it. Your thoughts, doctor?
Nowadays, social media is very, very big. It's huge. In fact, if you can get a message across, it's the best way. So, in fact, very recently we had done these videos and posted on social media about insulin, about foot, how important it is to have your foot checked up in time. And so this can get across to thousands of patients, literally speaking. And as we speak, there will be so many more who will be getting educated. But there is also a sort of double-edged sword kind of a thing, so it can backfire. So then there are other people who are also making similar videos and trying to project to the people that taking medicines is bad, your diabetes can be cured, etc., etc. And that is so painful for us to watch, because then we have seen our patients deteriorating with these kind of videos, and it's going viral. So I think if doctors can come together and they can, counteract this by themselves contributing in a very small way, maybe 2 minutes, 3 minutes videos, which can be actually seen, and this is what we have done in this pandemic.
Well, that's a great idea. Have doctors be part of the social media campaign where people are consuming this content, but when it is coming from a doctor, it makes a huge difference. We are going to take a break, and I'm going to come back to talk more about whether the quintessential question whether diabetes is reversible. But that is on the other side of the break. Don't go anywhere. Stay tuned. Welcome back to our special Live Well with Diabetes, where we are discussing everything diabetes, awareness, prevention, and timely intervention. Dr. Patil, my next question to you is, post the pandemic, we have seen people become more aware about their bodies and think about lifestyle changes, etc. But how important still is exercise in the post-COVID times? And with people who are living with diabetes, what kind of an exercise regime do you recommend?
Exercise is an integral part of diabetes management, no two ways about it. So the recommended exercise regimen for any diabetic is about 150 minutes per week, which is approximately 30 to 45 minutes 5 times in a week. Exercise should be moderate or to vigorous intensity of aerobic or cardio exercises, along with some weight training and resistance training exercises. So what the people who have time constraints to exercise and cannot go with gymming, no fancy equipments are needed to exercise. Simple brisk walking can do the needful. Keeping a step count as to how many steps are you walking during the day. Avoiding elevators, taking the stairs, they also count. In the office, while you talk, you walk. You get a phone call, you start walking immediately. So these all small contributions in day-to-day life in the office are going to count. At home, anybody can just stroll around while watching television. Even for that matter, while doing household works, like doing dishes, you can just do some stretching. Or in household chores also, you can inculcate exercise in day-to-day life. We can also plan our weekends around activity levels, like probably going cycling, swimming. Why not go hiking with the whole family? So that itself will add to exercising. Similarly, we can go window shopping. That also will add to exercising, isn't it?
That's a good one.
So some proactive thinking, like probably parking a car a little farther away from your office and walking down to your office, or probably just getting one stop ahead of your usual stop and walking down home. While you wait in the waiting areas in the office or on the airport, you may just choose to walk. So in small ways, adding exercise to our lifestyle, may just give us adequate goals or targets to be achieved in diabetes, which are important.
Dr. Dakshita, is it just us? Is it a gender problem? Are we the chosen ones? Or the question really is that, does diabetes differentiate between genders?
So I would say the change is the only constant in a woman's life. I think all of us will agree. And yes, there is a gender difference when it comes to management of diabetes, medically and socially and economically as well. You will understand it. Probably because of hormones, medically, there is a huge hormonal change at every stage. Be it at puberty, we have so many young diabetic girls. Then we have a tsunami of gestational diabetes.
Right.
Believe me, 1 in 9 pregnancies in India are diabetic.
Ma'am,
You
has
know?
that increased
Yes,
over a period of time?
absolutely. So 10% of pregnancies are diabetic pregnancies. It's just that we are not able to diagnose it. You know, and then menopause, the huge hormonal storm, you know. So every time the treatment changes. So at puberty, probably weight loss, lifestyle modifications, psychological counseling about peer pressure, screen time, ground time, you know, exercise. These are the things, addictions. These are few issues we really need to look into along with diabetic medications. When it comes to pregnancy and diabetes, she's the most motivated diabetic patient, you know, because of her maternal instinct. She's not worried about herself, she's worried about her child. I mean, the unborn child. That's the first thing. So insulin remains the cornerstone of therapy many of the times, and you definitely then need to monitor that woman. Menopause is, I would say, the most difficult period. Hormonal storm, depression, probably we all are going through this, you know. So psychological counseling, good protein supplement, vitamin supplement, calcium supplement, we need to look into all these supplements and counseling and support along with you know, modification in the medicine. Many a times we have to escalate the doses of medications at the time of menopause, then everything settles down. And the last but not the least, self-care or self-love,
Which
is
women,
something which women really
Yeah,
need to
avoid
look
and
into,
don't
so that
make
they
time
can
for.
take care of their diabetes, and they can probably avoid entry of diabetes in the next generation. They can
Right.
take care of their family.
We always relate diabetes with lifestyle and obesity and not being in your BMI. So how do you look at that scenario?
Yeah, so really very well pointed out, because obesity is now becoming a worldwide issue. In Indian scenario, it's not more of the BMI, it's more of the waist hip ratio that we talk about. So we are targeting weight which is abdominal and not on the hips. So it's more of abdominal obesity in India which is contributing to diabetes. So if you're looking at even the so-called thin person, if you're looking at the waistline is going to be much more than what it would be. So the waist hip ratio is very crucial. So for that, we need to be monitoring well, we need to be eating, lifestyle modification needs to be, because now everything is available, it's just a phone call away. I mean, you can just pick up your phone and get a pizza delivered in no time. Yeah, so then that is the whole issue. So the food is inexpensive, it is highly palatable, and then you do not wish to spend the same amount of time in your kitchen cooking a healthier version. So I think maybe that attitude really needs to take a step back.
Lifestyle change, then of course, for us and for our children,
Yes.
talks about a complete food change
Yes.
as well. But the question really that everybody wants to know is it reversible? I know the answer, sort of, but still.
See, I would like by making a statement saying that reversal is not a term firstly for type 1 diabetics because they are insulin dependent.
Right.
Now talking about reversal in type 2 diabetes, the appropriate term is basically remission and not reversal. So remission means a person is able to maintain healthy blood sugar levels without medications, and that is quite possible with nutritional interventions, exercise, good amount of weight loss, and sometimes yes, bariatric surgery is one of the options available over there. So, but what we see commonly is as soon as the interventions are stopped and a person gains the weight again, sometimes the diabetes may just reappear again. So the diets or the nutritional interventions which work for these category of patients who wants reversal are very low calorie diets, about 900, 1200 calorie diets, low carbohydrate diets. And this along with a good exercise regimen, sleep, lifestyle changes, stress management, sometimes the results are something to watch for, because eventually it leads to weight loss and then diabetes reversal can happen and person may have a long healthy life without medications. But at the same time we have to understand this, that reversal is most successful in young and newly detected type 2 diabetic patients who are obese. But it may not be possible in long-standing diabetes patients who are thin built or insulin dependent already.
Right.
Bariatric surgery is one of the options available to morbidly obese, that is the weight more than 100 or a BMI more than 30. Again, it leads to weight loss and then diabetes reversal eventually. So what I want to say here is that diabetes reversal, if there is a timely intervention at right time, probably is possible. And people can stay without medication for a very long time. Generally whenever we have a discussion at the clinic, I always tell my patients, see, it's a right combination of your diet, exercise, as well as your medication, which is going to bring in the results. So just having diet, exercise, ditching medicines may not work. At the right time, you need right amount of medications as well. And let's do it as a team. You do better, let's decrease the medication. You be on a front foot, I'll be on a back foot.
Right.
So that's how things work then.
Fantastic. Closing comments, what would you like to tell our audience who are watching? How to live well with diabetes, how to be aware, and what really we should be doing?
Yeah. So whenever you are diagnosed with diabetes, don't label yourself as a diabetic for your lifelong process or lifelong journey. You're Mugdha, I am Dakshata. So live like Dakshata. It's not like you're a
Do not
diabetic.
become your problem.
Yes, do not become your problem, right? And just understand this is just to streamline your lifestyle. It's not a negative metabolic problem. It is going to streamline your lifestyle. And I think it is positive thinking with which you should live well with diabetes.
Fantastic.
I think a good, healthy lifestyle, regular exercise, and a balanced diet would help us all live well with diabetes.
Fantastic.
What I feel is we as women are backbone of every household. So they say that charity begins at home, but I feel, that diabetes education begins at home. If we spend 10 extra minutes to educate any lady in our day-to-day OPD, probably we can bring up a good household. We can make our progeny healthier and healthier, and we can bring up a better tomorrow for our India. Live well with diabetes.
Fantastic. Thank you so much, doctors, for sharing these wonderful insights and taking time out of your busy schedule. Thank you so much.
Thank you.
And thank you all for being a wonderful audience. The take-home message is simple. Include exercise in your routine, go for regular tests, make healthy eating choices, and keep a tab on your weight. Stay healthy and stay safe.